be able, if the case is a bar with some kind of attachments, is the patient going to be able to remove the case, the overdenture for cleaning or not? So we have on the fixed restorations, we have a screw retained and cemented, and then the type of restoration for screw retained could be porcelain bonded to metal or whatever. I'm going to list that later on. Or here it is. For gold, titanium, zirconium, or metal based. And then the cemented restoration, there's going to be porcelain bonded to the abutment that is made out of gold, titanium, zirconia, or base metal. And then removable restoration, we have that they attach with the implants, so we could have locators, balls, or ORS. So now I would like to talk to you about the step-by-step how I like to see the cases proceeding in the lab. So the first appointment would be, for the reason this clicker is not working, so I have to click it this way. So on the first appointment, the doctor is going to consult with the patient what the patient would like to have. And again, this is a little bit so summarized because are you going to be placing the implants, or you're going to have somebody else placing the implants, and then you're going to be restoring only. So I assume that the implants are already in. So then the consultation, what you have to gather the information, what type of implants the patient has, so you could order the appropriate components, impression copyings, and then what type of restoration the patient is going to have. So hopefully that was already decided before the implants were placed, because very often it happens that the patients are showing up at the doctor's door, office, and then they say, I want to have a fix. Yeah, but you have implants already in the mouth. Yes, I know, but I want to have a fixed restoration, and so sometimes there's a problem. So we have to know what the patient wants to have. Can they clean it? What is the dexterity? And are the bruxers? Because if the patient is a bruxer and we make a hybrid restoration with the denture teeth, probably they're going to destroy this very quickly. So on the lab side, talk to the lab so that consult the lab to see if all the stuff is doable. So I just add this. I was playing around with my presentation. I was listening to the speakers, so I added that when Dr. Robin was making a presentation. So when you look at this case, you see the vertical. That's a huge bone loss here. And so from the plane of occlusion to the top of the implant is 30 millimeters. So, and the patient, doctor, I'm not exactly sure whose idea that was, they decided to have a porcelain bonded to metal. And so the doctor called me and says, Slawek, I have this case, but I'm not exactly sure how we're going to do that, because there's a lot of vertical. And considering that the implants are only here, so there's a 5, 6, 7 on both sides. The implants are on both sides, 5, 6, 7. So first, you have the cantilever. This is what we were talking about before. That can this patient, or can the implants support that kind of cantilever? Personally, I don't know. I worry a little bit. But the doctor says, Slawek, the patient has the denture for 3 years already, and there's barely any sign of wear and tear. So she doesn't have any parafunction and so on. So it's okay. So if you have a patient that is for so long with a temp, so probably it is going to be okay. I hope so. But then the other question was, if you have a 30 millimeters of vertical, how are you going to screw the restoration in? Because I need the shank of the screwdriver has to be 30 millimeters. Personally, I don't know any screwdriver that will be so long, but I can make you, because we do make screwdrivers that are extra long.